Hello. So everyone is really curious to know what's happening to 92507. CPT codes are periodically reviewed by CMS and the American Medical Association to ensure that the code set continues to reflect real-world clinical practice. Every code is subject to review, regardless of the profession involved. Reviews may occur for a variety of reasons, though. These can include the age of the code, changes in utilization patterns, updates in clinical practice, or outdated practice expense information. This review process has been in place for many years and will continue as part of maintaining an accurate and relevant CPT code set. In April 2024, CPT code 92507 was identified through a high volume growth screen after Medicare utilization increased by more than 100% between 2017 and 2022. Although this initial flag came through Medicare data, Medicaid utilization demonstrated a similar pattern of growth. Medicaid claims for CPT code 92507 increased 11,866,679 claims in 2018 to 24,118,668 claims in 2023. Please note that this change is based on utilization data collected between 2018 and 2022. During that period, both Medicare and Medicaid demonstrated substantial growth in utilization despite differences in baseline volume. As this chart shows, the utilization trends for both Medicare and Medicaid follow very different or similar patterns over time. While the baseline volumes differ, both programs have experienced significant growth in utilization during the reporting period. Once a code is identified through CMS's high volume growth screen, it enters a structured and well-established review process. In that context, ASHA's responsibility is to engage fully to ensure that speech-language pathology services are accurately represented. So what were our actions? Our actions included extensive collaboration, not just with subject matter experts from the Healthcare Economic Committee, but also subject matter experts throughout the nation, as well as careful review of current clinical practice patterns, the available clinical evidence base, and also payer considerations. ASHA's participation helps ensure that the profession's clinical expertise and data meaningfully inform the review process. CPT code 92507 describes treatment of speech, language, voice, communication, and/or auditory processing disorder. Individual. It has 60 minutes of underlying time and valued at 2.28 RVUs, which is further broken down into work RVUs at 1.30, practice expense at 0.97, and malpractice at 0.01. It is an untimed code. And although it is an untimed code, it was originally value based on the typical session involving 60 minutes of time. The primary treatment code currently in use was created more than 30 years ago and was last formally surveyed in 2010. Since that time, both the scope and the complexity of speech-language pathology services have evolved significantly. Clinical practice has expanded, patient needs have become more diverse, and treatment approaches have become advanced and considerably across settings and populations. Today, this code functions as a broad catch-all category that encompasses a wide range of speech and language and communication disorders. And while the code has been valuable in supporting access to care across many clinical settings, it does not adequately distinguish between the differing levels of clinical expertise, complexity, treatment intensity, and resources required for various conditions. For example, the treatment of articulation or speech sound disorders often involves very different assessment tools, therapy techniques, clinical decision making, technology, and clinician time compared with the treatment of cognitive communication disorders, aphasia, voice disorders, motor speech disorders, or even swallowing related communication impairments. These services can vary substantially in both the complexity and care and the resources necessary to provide effective treatment. Another important limitation is that the current practice expense inputs remain heavily weighted towards supplies and equipment traditionally associated with speech, sound, and articulation therapy. As a result, the existing valuation framework does not fully or accurately capture the broad range of resources, technologies, clinical preparation, and specialized expertise required to treat the full spectrum of communication disorders encountered in contemporary practice. Overall, these limitations support the need for updated and more specific CPT codes that better reflect current clinical realities, evolving standards of care, and specialized expertise, and resource utilization across all speech language pathology services. The goal is to ensure that the coding structure more accurately represents the work clinicians are doing every day to meet the increasingly complex needs of the patients they serve.
Thank you to everyone for being here today, and thank you for that foundational knowledge. So we're going to move into now an overview for everyone on understanding the CPT process. And on the next slide, we will begin with how a code becomes a code.